The Spanish flu, which occurred between 1918 and 1919, was an extremely deadly influenza pandemic that affected people worldwide. Here is an extreme fact about the Spanish flu. The Spanish flu infected approximately one-third of the global population at the time, which was around 500 million people. This makes it one of the most widespread pandemics in human history. To put it into perspective, the global population in 1918 was roughly 1.8 billion, so the Spanish flu affected a significant portion of humanity. Furthermore, what made the Spanish flu particularly extreme was its high mortality rate, especially among young adults. While most influenza viruses primarily affect the very young and the elderly, the Spanish flu had a unique pattern of targeting healthy adults in their prime. This resulted in a disproportionately high number of deaths among individuals aged 20 to 40. The exact number of deaths caused by the Spanish flu is difficult to determine due to limited data and reporting at the time. However, it is estimated that the death toll ranged from 20 to 50 million people worldwide, possibly even higher. Some estimates even suggest that the death toll could have reached as high as 100 million people, surpassing the total number of casualties during World War I. The extreme impact of the Spanish flu on a global scale, its ability to infect a significant portion of the population, and the high mortality rate it exhibited, make it one of the most devastating pandemics in human history. While the Spanish flu and COVID-19 are two different viral illnesses caused by distinct pathogens, the Spanish flu was caused by the H1N1 influenza A virus, while COVID-19 is caused by the SARS-CoV-2 coronavirus. There are several similarities between them. Here are some notable similarities. Global spread. Both the Spanish flu and COVID-19 spread rapidly across the globe. They became global pandemics affecting numerous countries and populations worldwide. Respiratory transmission. Both diseases primarily spread through respiratory droplets. When an infected person coughs, sneezes, or talks, they can release respiratory droplets containing the virus into the air, which can be inhaled by others nearby, leading to transmission. High contagiousness. Both the Spanish flu and COVID-19 are highly contagious diseases. They can spread easily from person to person, contributing to their rapid dissemination within communities. Symptomatology. Both illnesses can present with similar symptoms, including fever, cough, fatigue, body aches, and respiratory issues. In severe cases, both can lead to pneumonia and acute respiratory distress syndrome, ARDS. Impact on vulnerable populations. Both the Spanish flu and COVID-19 have disproportionately affected vulnerable populations, including the elderly and individuals with underlying health conditions. These groups are more susceptible to severe illness and have a higher risk of complications and mortality. Public health measures. Similar public health measures have been employed to combat the spread of both diseases. These include social distancing, wearing masks, hand hygiene, isolation and quarantine protocols, and travel restrictions. Strain on healthcare systems. Both pandemics have placed significant strain on healthcare systems worldwide. The sudden influx of patients requiring medical attention, particularly those with severe respiratory distress, has challenged hospitals and healthcare infrastructure.